Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Today I'm going to be describing and demonstrating thoracic spine extension on a BOSU ball. This is an advanced exercise, so you want to start with some basic extension motions and then move to this stretch using the BOSU ball. As you can see, I am laying supine. My hips are flexed, my knees are flexed, and my feet are flat on the floor. You want to place the thoracic spine. First of all, thoracic spine is the medical name for the neck. You want to place the upper thoracic spine on the BOSU ball, and you want to make sure that the back of the head is always contacting the ball and that the lower thoracic spine is contacting the ball or kept as low as you possibly can. This is going to allow a more effective stretch in the upper thoracic spine. You can start this motion with your hands just placed on your stomach, and you want to place the shoulder blades. The shoulder blades are called the scapula in medical terminology. You want to place the scapula over the highest point of the ball. And again, you're keeping the back of your head and the lower part of your thoracic spine contacting the ball. And you just want to stretch the upper thoracic spine backwards. And you move into the stretch slowly and hold a mild, comfortable stretch anywhere from 5 seconds to 120 seconds. Once that time frame is completed, you move up on the ball. And again, follow the same steps so that the back of the head is contacting the BOSU ball. The lower part of the thoracic spine is contacting the BOSU ball, and the upper part of the thoracic spine is moving into extension. The body is going to contour around the shape of the ball. This is going to help to move the thoracic spine into extension. Hold a mild, comfortable stretch anywhere from 5 seconds to 120 seconds. Once that time frame is up, then you move up on the ball again, and you perform the same steps. Keep the posterior aspect of the head contacting the ball. Keep the lower part of the thoracic spine contacting the ball. Keep the glutes contacting the floor. The hips are flexed, the knees are flexed, and the feet are flat on the floor. The hand stays on the stomach, and you stretch the upper back into extension. Hold a mild, comfortable stretch anywhere from 5 seconds to 120 seconds. And then you want to go back to the starting position, and you are going to perform it with the shoulders in a position of 90 degrees of abduction. So the arms are out to the side, they are perpendicular to the body. This motion is shoulder abduction. So at 90 degrees of shoulder abduction, the arms are perpendicular to the body. And again, you're going to follow the same procedure. Now, one thing I did want to mention is that you always want to check with a medical professional before you perform this exercise to make sure that you are healthy enough and that your spine is healthy enough for this exercise. You always want to be safe. You can work with a fitness professional or with a rehab professional to learn proper technique. Viewing this video does not take the place of seeing a medical professional, working with a fitness professional, or working with a rehabilitation specialist. Never perform an exercise that elicits or intensifies symptoms. If any exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. These symptoms can be anything from pain, numbness, tingling, burning, dizziness, any of the above or more. Now you can move up on the ball and perform this stretch again in a different position. You always want to use a variety of positions. Move into the stretch slowly and hold a mild, comfortable stretch. And then once you have performed the stretch for your desired time frame, then move up on the ball again and perform the stretch again. This is going to help the thoracic spine, which is the medical name for the mid-back, to stretch into extension. Hold a mild, comfortable stretch between 5 and 120 seconds. Always keep the glutes contacting the floor. Always keep the lower part of the thoracic spine contacting the ball, and keep the back of the head contacting the ball. And an even more advanced version of this is that you could perform it with the shoulders in 180 degrees of flexion. This motion is shoulder flexion. So this is as you are reaching overhead. So again, position your shoulder blades so that they are positioned on the ball. Keep the glutes contacting the floor. Keep the back of the head contacting the floor, and keep the lower part of the thoracic spine as low as possible contacting the ball. And let the upper thoracic spine bend backwards into extension. Hold a mild, comfortable stretch, anywhere from 5 to 120 seconds. And then relax and move up higher on the ball. And repeat. And then you could do this at several positions on the ball. This is going to help to stretch the thoracic spine. Thank you everybody for watching today's video on spine health. Always remember, never perform an exercise that elicits or intensifies symptoms. Always work through a symptom-free range of motion. Always check with a medical professional before starting any type of exercise program. Please feel free to like, comment, and subscribe. You can visit my website, championshipchiropractic.com, where you get information on my book titled Running, Maximize Performance and Minimize Injuries. And you could also find my blog on my website. My blog contains articles on spine health, sports medicine, chiropractic, health, fitness, and nutrition. Thank you again for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.